one of the big problems is that we're getting very good now with these diagnostics, the MRI, the RT-QuIC. One of the problems that I'll certainly be the first to admit with the MRI is that it's often misread. The abnormalities are there. If you're experienced and you look at the MRI, the diagnosis is right in front of you. We did a study in which we found that in the United States, 2/3 of MRIs in patients who have prion disease are misdiagnosed. The radiologists miss the diagnosis of Creutzfeldt-Jakob disease or prion disease. And in well, actually in about 1/3 of those cases, they actually saw the abnormalities. These are abnormalities along the surface of the brain, which I call cortical ribboning, or bright areas on certain sequences in the center of the brain in the deep nuclei. And it can be any combination of those. But those, so in 1/3 of cases, the radiology reports noted these abnormalities but did not know to attribute them to prion disease. Scarily, to me, in 2/3 of the patients, they didn't even mention the abnormalities. They missed them. And my colleagues in the UK also found similar findings. They found about 56% of MRIs were misread in the UK. So, so we have to get better at reading the MRIs, and often you'll do an MRI before you'll do a spinal tap. So if you misread the MRI, you don't even know what to send in the spinal fluid to think about prion disease. And the other thing that we found is that by the time CJD is the leading diagnostic contender for patients who ultimately are shown to have prion disease, patients are already 2/3 of the way through their disease course. So we have to recognize these patients earlier. We have to, and the only way that's going to happen is to teach doctors about these diseases so that they think about them sooner, and then they can send the tests that we have that have gotten really good.